Imagine living in a world where your own red blood cells, the carriers of life-sustaining oxygen, turn against you, triggering excruciating pain, compromising your organs, and challenging your very existence. This isn't a dystopian fiction. It's the reality for millions of people battling a silent genetic adversary known as sickle cell disease. Today, we embark on a journey to unravel the mysteries, complexities, and resilient spirit surrounding this genetic enigma. Welcome to the exploration of sickle cell disease, where every cell tells a story, and every story needs to be heard. Sickle cell disease, SCD, is a genetic blood disorder that is characterized by abnormal hemoglobin, resulting from a specific mutation in the hemoglobin B, HBB, gene. This mutation leads to the production of hemoglobin S, HbS, causing red blood cells to assume a sickle shape. As an autosomal recessive trait, SCD manifests when an individual inherits two abnormal copies of the gene, one from each parent. The altered shape of red blood cells can lead to various complications, impacting oxygen delivery, and causing symptoms such as anemia, pain crises, and organ damage. Genetic basis of sickle cell disease. At the heart of sickle cell disease lies a genetic anomaly. Individuals with SCD inherit two abnormal copies of the hemoglobin gene, one from each parent. Specifically, a single nucleotide substitution in the HBB gene results in the production of abnormal hemoglobin known as hemoglobin S, HbS. This seemingly small genetic alteration sets the stage for the complex manifestations of sickle cell disease. The inheritance pattern follows an autosomal recessive trait. If both parents carry the abnormal gene, there is a 25% chance with each pregnancy that their child will inherit two copies of the mutated gene, manifesting as sickle cell disease. If only one parent carries the gene, the child becomes a carrier or has sickle cell trait, which typically presents with no symptoms but carries implications for future generations. Molecular basis. Hemoglobin, the oxygen-carrying molecule in red blood cells, undergoes a remarkable transformation in individuals with sickle cell disease. Hemoglobin S is prone to polymerization under certain conditions, leading to the formation of long, rigid structures within the red blood cells. As a consequence, these cells lose the usual flexibility and adopt a sickle shape. The altered shape renders red blood cells less capable of smoothly navigating through blood vessels. Instead, they become sticky and prone to clumping together, causing blockages that impede blood flow. This impaired circulation is a key contributor to the myriad of symptoms associated with sickle cell disease. Clinical manifestations. 1. Anemia. The abnormal shape of red blood cells in sickle cell disease reduces their lifespan, leading to chronic hemolytic anemia. This results in fatigue, weakness, and pallor, common symptoms of decreased oxygen carrying capacity. 2. Vaso-occlusive crises. Perhaps one of the most characteristic features of sickle cell disease is the vaso-occlusive crisis. The clumping of sickle cells obstructs blood vessels, causing sudden and severe pain in various parts of the body. These painful episodes can last for days and are often triggered by factors such as dehydration, infection, or stress. 3. Organ damage. The cumulative effects of vaso-occlusion and chronic anemia can lead to organ damage over time. Organs such as the spleen, kidneys, and lungs may be particularly affected. Splenic sequestration, where blood pools in the spleen, is a critical concern, especially in pediatric cases. 4. Increased infection risk. The compromised spleen function in individuals with sickle cell disease predisposes them to an increased risk of infections, particularly from encapsulated bacteria. This vulnerability underscores the importance of preventive measures, including vaccinations and early intervention with antibiotics. 5. Acute chest syndrome. A potentially life-threatening complication, acute chest syndrome, can occur when sickle cells block blood vessels in the lungs. This leads to symptoms such as chest pain, shortness of breath, and can result in respiratory failure. Impact on individuals. Living with sickle cell disease entails navigating a complex landscape of physical and emotional challenges. Beyond the visible symptoms lie the daily struggles associated with managing chronic pain, potential organ damage, and the ever-present uncertainty of when a vaso-occlusive crisis might strike. Individuals with sickle cell disease often face disruptions in their education and employment due to hospitalizations and the need for ongoing medical care. The burden extends beyond the affected individuals to their families and communities, emphasizing the importance of a comprehensive support system. Diagnosis and screening. Early diagnosis of sickle cell disease is crucial for implementing effective interventions and preventing complications. Newborn screening programs in many countries have significantly improved the early detection of the disease. A simple blood test can identify the presence of abnormal hemoglobin, prompting further diagnostic tests to confirm the diagnosis and determine the specific type of SCD. Management and treatment. 1. Hydroxyurea. Hydroxyurea has emerged as a key medication in the management of sickle cell disease. It works by increasing the production of fetal hemoglobin, a form of hemoglobin less prone to sickling. This medication has shown efficacy in reducing the frequency and severity of vaso-occlusive crises. 2. Blood transfusions. In cases of severe anemia or complications, blood transfusions may be recommended to replace damaged red blood cells and improve oxygen delivery. 3. Stem cell transplant. For select individuals, a stem cell transplant can offer a potential cure. This procedure involves replacing the bone marrow with donor cells that produce normal hemoglobin. 4. Pain management. Addressing pain is a central aspect of sickle cell disease management. Analgesic medications, both opioid and non-opioid, are commonly used to alleviate pain during vaso-occlusive crises. What does the future hold? The future holds promising prospects for individuals living with sickle cell disease, SCD, with ongoing research, advancements in treatments, and increased awareness fostering hope. Here are key areas indicating hope for the future of sickle cell disease. 1. Genetic therapies. Gene editing technologies. Emerging technologies like CRISPR-Cas9 offer the potential for precise gene editing. This opens avenues for correcting the genetic mutations responsible for sickle cell disease, providing a potential cure. 2. Stem cell transplants. Advancements in transplantation. Improvements in stem cell transplantation techniques, including reduced-intensity conditioning regimens, may make this option more accessible and safer for individuals with sickle cell disease. 3. New medications. Ongoing drug development. Pharmaceutical research is focused on developing new medications that can effectively manage symptoms and complications of SCD. 4. Global collaborations. International collaborations. Global initiatives and collaborations among researchers, healthcare professionals, and advocacy groups are contributing to a deeper understanding of SCD. This collective effort enhances research outcomes and promotes the sharing of knowledge and best practices. 5. Improved access to care. Enhanced healthcare infrastructure. Efforts are underway to improve healthcare infrastructure, especially in regions where sickle cell disease is more prevalent. 6. Advocacy and awareness. Increased awareness. Ongoing advocacy efforts are raising awareness about sickle cell disease, reducing stigmas, and fostering understanding. Increased public awareness can lead to better support systems and improved quality of life for individuals with SCD. 7. Research on complications. Understanding complications. Research is focused not only on the primary causes but also on understanding and mitigating complications associated with SCD, such as acute chest syndrome and organ damage. 8. Education and counseling. Patient education programs. Ongoing efforts to educate individuals with SCD about self-management, preventive measures, and the importance of regular medical checkups contribute to better disease management. 9. Holistic support systems. Psychosocial support. Recognizing the importance of psychosocial well-being, there is an increasing focus on providing holistic support systems, including mental health services and community support groups. In conclusion, the hope for the future of sickle cell disease lies in the convergence of scientific advancements, improved healthcare infrastructure, heightened awareness, and a commitment to collaborative efforts. As these elements continue to progress, there is optimism for enhanced treatments, better quality of life, and ultimately a brighter future for individuals affected by sickle cell disease.